Welcome back to the Best PT Podcast. This is episode 33, talking about health insurance. Private health insurance. We have stock companies that are national companies owned by independent stockholders. Mutual companies. These are national companies that are owned by the individual policyholders, kind of like a credit union. Some examples include Liberty Mutual, Mutual of Omaha, Nationwide, State Farm, and USAA. Nonprofit insurance plans operate in specific locations only, are subject to state regulation, but are tax exempt. Independent health insurance. We have managed care plans, HMOs and PPOs. The goal is to provide the highest quality care at the lowest cost. Policyholders use contracted healthcare providers. The providers share in the financial risk, and policyholders pay a fixed monthly prepaid fee. Health education and prevention are said to be emphasized. Health maintenance organizations, or HMOs. In these systems, the primary care physician controls healthcare access through a referral system. Preferred provider organizations, PPOs. Subscribers can choose from a list of providers that are said to be in-network with the insurance company. Consolidated Omnibus Budget Reconciliation Act, or COBRA. This is a law that says employers must allow employees to remain under an employer group health insurance plan for a period of time following job loss, death of a spouse, divorce, or decrease in hours. However, the employer can charge the employee the full insurance amount. Government health insurance plans. Medicare is health insurance for those over 65 years old or on disability. Part A Medicare provides care for hospitals, outpatient diagnostic services, extended care facilities, hospice, and short-term care facilities. Enrollment in Part A is automatic and paid for through payroll taxes. Part B Medicare provides outpatient care, physician services, and medical equipment. Enrollment in Part B is voluntary and usually paid for out of pocket by the beneficiary. Limitations to Medicare. Deductibles must be met before Medicare payment is activated. They share in 80-20 co-insurance for hospitalizations. So the government pays 80%, the beneficiary pays 20%. Medicare users are subject to a lifetime pool of days limit for hospitalization, and they are limited to 100 days per year of extended care facility benefits. Medicaid provides basic medical service to low-income citizens, including inpatient and outpatient hospital services, physician services, diagnostic services, home health care, and family planning. Workers' compensation provides the continued income and paid medical expenses for employees that are injured on the job. Employers with 10 or more employees or high-risk employees must pay a percentage of each employee's salary towards the Workers' Compensation Board of each state. And fee-for-service care models usually also employs an 80-20 copay system. They're said to have a minimum emphasis on health promotion, prevention, and wellness, with limited cost controls where payers assume most of the financial risk. And when people say back in my day reimbursements were a lot better, they're talking about the fee-for-service care model. That's it for episode 33, talking about health insurance. Episode 34 will discuss patient education. As always, the outline will be in the show notes. Thanks for joining me.